Well, consultant psychiatrist Dr. David Bell, who served as a staff governor at the Tavistock Trust, wrote an internal report back in 2018, raising the concerns brought to him by colleagues about the way the Gender Identity Development Service was treating patients. He faced disciplinary action. But after 24 years working with the Tavistock, Dr. Bell, a former president of the British Psychoanalytyc Society, has recently retired. And in his first television interview since then, he began by outlining his worries about the service.
The main concerns were issues to do with lack of consent. That many of the people who spoke to me did not think the children were able to consent to the treatment. Then there were concerns of children being inappropriately pushed through to transition, whereas they had a lot of complex problems. As a result, children have been very seriously damaged.
Well, that's quite an allegation, very seriously damaged. Are children currently at risk in this service?
Well, they're less at risk now because the puberty blockers have been stopped. The puberty blockers have been stopped because there is no evidence base for them at all. And the judicial review revealed that there was no follow-up of patients, no data, and remarkably little knowledge of what happens to these children. By putting on that pathway, it rather becomes a self-fulfilling prophecy. The children have been diagnosed now as their main problem being gender. The other problems are left aside. And this results, in my view, in many children having inappropriate medical treatment.
Well, given that many of your concerns were echoed in the judicial review, the Kirabel High Court ruling, how important is it that judgment stands, despite the fact that the Tavistock has been given leave to appeal?
Children of that age, say 10, 12, 13, 14, can they really, and given that they're very disturbed at the time, are they really in a position to weigh up and understand what the implications for them are? What they want is something done now. I want to change now. So the judgment is really important because it acts to protect children. 35 to 40% of these children are on the autistic spectrum. Large number of them have been exposed to major trauma. Large number have very serious family problems. And a particularly large number of them, young girls, could be helped to become non-gender conforming lesbian women. So the repositioning of these girls as having a gender problem, it acts to prevent them developing in a normal way and being able to develop their own, if you like, non-conforming gender identity and their own sexuality. This is a form of conversion therapy for young people who are gay or lesbian. It suppresses their sexual identity.
To a lot of trans people listening, though, you're questioning their very identity in a way that they would find deeply hurtful. Do you worry that you might be on the wrong side of history here?
Well, I think one has to just pull back a little bit, first of all, and recognise that this is a very highly politicised area. And leaders of movements with a very powerful ideological commitment have managed to capture policy, both medically, professionally, in the media, and in government, with no evidence base. It's a purely highly politicized movement which has had these consequences. So all that I am saying, and many people are saying, is that they need to wait. There needs to be a thoughtful engagement with them, as opposed to motoring them through to treatment pathways which have irreversible consequences for their bodies. So we're talking about not doing harm to children.
You've just retired as a consultant psychiatrist at the Tavistock, but right up until the moment of your retirement, they were pursuing disciplinary action against you. Do you think they tried to hound you out?
No, I don't think that would be the right. I don't think they were trying to hound me out. But I think what they were doing was making it clear that people like me who spoke out will come under the scrutiny in this very negative way and be exposed to the possibility of disciplinary hearings. Not long after my report came out, the chief executive made a public statement in which he said, that those who raise criticisms against the trust have an unfortunate attitude to gender. Now, of course, I don't know what unfortunate attitude to gender means, but I think this is like a message to everyone else who doesn't have my seniority and my safety, really. Oh my God, I better not speak out because they'll think I'm transphobic.
Dr. David Bell, thanks very much.
Thank you.
The Tavistock interview to respond to Dr. Bell, but they did give us the following statement. We are disappointed to hear these allegations. As a specialist NHS service, we focus on providing psychosocial assessment and support for young people experiencing difficulty with their gender identity. The minority of our patients who are referred for puberty blockers prescribed by other NHS trusts have undergone a thorough assessment. Additionally, the Care Quality Commission's view is that referrals of young people for medical treatment are consistent with good practice. This practice is guided by evidence, and it is wrong to suggest there is any rush to physical treatment. The Trust is always open to a breadth of views, but it asks, particularly on behalf of its dedicated staff and its patients, that this is done in a manner which is respectful and accurate.